www.healthcmi.com. Acupuncturist Continuing Education Online. And now, let's take a look at PID in Chinese medicine. So, a quick overview. In traditional Chinese medicine, pelvic inflammatory disease is categorized under several classifications, including dysmenorrhea, leukorrhea, menorrhagia, that is, abnormally heavy uterine bleeding at menstruation, menorrhagia, infertility, and palpable masses. PID is the inflammation of one or more of the following: the cervix, the uterus, fallopian tubes, ovaries, broad ligaments, and the peritoneum, and its connective tissues of the pelvic cavity. In some cases, PID may involve the scarring of internal tissues, and then that's what causes infertility. Again, lower abdominal pain and vaginal discharge, leukorrhea, are the predominant symptoms. PID is the invasion of damp heat and toxins causing qi and blood stagnation in the lower burner. So if there's any takeaway from today's webinar, it's damp heat and toxins causing qi and blood stagnation. Let's take a little deeper look. The acute stage is characterized by heat more than damp, and the chronic stage is characterized by damp more than heat. The chronic stage can also combine with qi and blood stagnation, but also qi and yin deficiency. So for the treatment of chronic PID, general treatment principles are often combining clearing heat and toxins and damp heat from the lingering stages, regulating qi, expelling dampness, warming the channels, transforming phlegm, and expelling stagnation. So again, starting with the damp heat and toxin, qi and blood stagnation, moving later into combining with qi and yin deficiency, we'll be needing to regulate the qi, expel dampness, warm the channels, transform phlegm, and expel stagnation. And we'll take a detailed look at the herbs and acupuncture involved in doing precisely that. For leukorrhea, in Chinese medicine, we categorize that typically as red, yellow, and white belt leukorrhea. Those occur when there's a disruption of the Dai Cheng and Ren, the girdle penetrating and conception channels. So, disruption of the Dai Cheng and Ren due to damp heat in the lower burner or qi and blood deficiency leads to leukorrhea. And this, of course, is our major factor in PID along with lower abdominal pain. So white belt leukorrhea is characterized by clear or white vaginal discharge, usually without odor, and it involves spleen, qi, and or kidney yang deficiency with excess dampness. Yellow belt leukorrhea is characterized by yellow vaginal discharge and has a foul odor and involves spleen damp heat or liver and gallbladder damp heat. So yellow and white belt. One more a deficiency, one can be more damp heat. And of course, red belt leukorrhea is characterized by the presence of blood. And that blood is in the vaginal discharge and involves heat in the blood or liver heat changing into fire. And we also see that even combining with deficiency. So already, just by looking at the red, yellow, and white belt leukorrhea, we know we need to treat the Dai Cheng and Ren channels. We know that we may need to treat for the white belt leukorrhea spleen, qi deficiency, or kidney yang deficiency with excess dampness. We know with yellow belt deficiency to treat the spleen damp heat or liver and gallbladder damp heat. And of course, in the red belt leukorrhea, we have heat in the blood and liver heat changing into fire. So we'll be cooling that liver heat and cooling the heat in the blood. important factors of susceptibility to PID are an important topic to cover. And straight Chinese medicine factors are taken during the intake. So during the patient history, then we'll really get a clear idea of screening for PID. And number one is simply screening for STDs, sexually transmitted diseases, particularly gonorrhea and chlamydia. So once we know there's been a history of that, we want to see if there's been leukorrhea and lower abdominal pain, either an acute or chronic stage. Right away, we know PID potentially. Uterine foreign object, so that's the IUD. And that starts with unilateral pain and, of course, can become bilateral. The modern intrauterine device, the IUD, is a form of birth control. It's a small T-shaped device. It contains either copper or progesterone, and it's inserted into uterus. So the copper IUD, the copper itself, acts as a birth control device. And then, of course, the biochemical IUD uses progesterone to prevent pregnancy. Sexual intercourse 1 day prior to or during menstruation can lead to PID. Surgery in the pelvic cavity. Abortion, especially multiple abortions. Postpartum stages are a high factor of susceptibility to PID. Miscarriage, especially chronic miscarriages. And of course, nearby organs can transfer the infection to the pelvic cavity, including the urination bladder and large intestine, especially in the case of an appendicitis, transferring an infection. So again, that's part of that cycle where we're trying to differentiate between appendicitis and PID, but once we have an appendicitis, it can easily create the factors for PID. And finally, following the very first time of sexual intercourse, there can be PID. So those are the 9 major factors of susceptibility. And we're basically looking for ways that microorganisms can create infection in the pelvic cavity. Let's take a look at the acute stage of PID in Chinese medicine. In general, pulse is going to be slippery and rapid, so damp and heat. The tongue is going to have a red body with a thick yellow coating typically. And there's 3 major ways to look at this. One is a damp heat and toxins in lower burner. We can break that down by the Wenbing and the 4 levels of differentiation. So Qi level heat may enter and progress to the Ying level. And in the 6 stages, we can say that Yangming stage illness may then progress to the Taiyin stage. So let's take a quick look at the Wenbing theory here, the 4 levels. As we know, the Qi level is involving organs like the stomach, intestines, and lungs. Basically, the Qi level presents with high fever, no chills, and aversion to heat. Like Yangming stage, it does have constipation involved typically, and maybe the patient wants to drink a lot of cold water. The urine tends to be concentrated and yellow, and there can be chest pain from congestion and stagnation, and that's heat in the lungs. So again, an acute illness affecting the patient, and we're looking for that high fever. The tongue body will be red, and in this case, of course, the coating can be yellow, even dry and thick from the heat, and possible cracks due to the severe heat. The pulse can even, in the Qi level, be big, rapid, but can also be deep. So it can be excess, it can be powerful and forceful, we're looking for. There can also be just general symptoms of common cold and the flu, like a cough, yellow-green mucus, so not just involving the lower abdominal cavity being affected by this Qi level heat, coming on really like a common cold or flu. And in fact, any kind of virus or bacterium that creates common cold or flu can then lead to PID. So in some cases, we use clearing the heat or even purging the heat for Qi level heat. In Western medicine, some cases are kind of defined as bronchitis or pneumonia, but again, when it affects the lower jiao, it can then lead to PID. And then the Qi level heat progresses to the Ying level, and that's when we're moving towards a chronic stage of illness. In Ying level heat, still there can be high fever with mental restlessness. So there can be the high fever, but also insomnia, kind of illogical thinking. So the Shen is disturbed in this case, affecting that heart and pericardium. So it can even lead to states that are nearing coma in extreme cases. All the symptoms are stronger at night. Again, Ying is near the blood, and the blood is yin because it's inside the vessels near the blood, that nutrient level heat. And a patient is usually thirsty, but again, it's deficiency, so they may not want to drink, particularly in children. There can be a slight thirst. Again, this is the stomach qi being low. There can be skin rashes with Ying level heat. For example, measles at the spotting stage represents the heat toxins, the heat poison. There can be some bleeding in the spots, especially as it approaches the blood level. So again, Ying level is not quite heat in the blood level yet, the fourth stage, but it can start to show those types of symptoms. The tongue can be deep red. It can have strawberries, cracks. Usually the coating is burnt out a bit, so the yin is burnt out, so we get less of a coating. Again, if there's enough dampness, there'll be a coating. So that won't be necessarily a factor in looking for PID. Sometimes there's no coat, sometimes there's a yellow coat. The pulse can be rapid, small, and weak. So the body qi level is getting low. And the treatment, of course, with Ying level heat is to clear heat, cool the blood, clear the heat from the pericardium, open the heart orifice. And again, it's the nighttime symptoms getting worse, which will tip off a lot of Ying level heat. And again, high fever, insomnia, illogical thinking. Sometimes we'll just say it's Ying level heat when we're looking at the skin rashes starting to emerge with that. So there we have the 4 levels differentiation of PID in the acute stage, Qi level heat that may progress to the Ying level. Now let's take a look at the 6 stages differentiation from the Yangming stage illness that progresses to the Taiyin stage. So another look at acute PID. Yangming stage illness affects the stomach, foot Yangming, and large intestine Yangming channels, and it's heat symptoms. It involves a strong fever. We actually say the 4 bigs, right? High fever, big sweating, big thirst, and big pulse, meaning a strong and full pulse. So it's a strong fever with mental restlessness and irritability. So that's that heat coming up. The flushed face, again, the stomach and large intestine channels are having heat, and we see that through the meridian in the face. The tongue is red with the yellow coating, usually dry. The pulse is rapid, again, strong and full, forceful. There's internal heat, so there can be constipation and what we would call Yangming fu organ involvement, burning urination, concentrated yellow urination, thirsty. There's usually an afternoon high fever, strawberries on the tongue, and of course we want to clear the heat for this. The Yangming fu organ syndromes of the stomach and intestine typically are constipation, a bloated abdomen, usually painful, it's excess, so pressing upon palpation will cause even more pain, and again accompanied by high fever, big sweating, mental restlessness. So the treatment is to cool. Sometimes with the Yangming fu organ, of course, we'll be purging to cool, to make a little diarrhea to release the heat. In the clinic, we often see the Yangming stage then progressing into the Taiyin stage, which affects the spleen and lung Taiyin channels, which is moving more towards deficiency. The Taiyin stage, think of the spleen channel being affected, the spleen Taiyin channel, and also the lung. We're looking for a bloated abdomen. It actually can have comfort upon being pressed. Now that's interesting because in classical theory, the Taiyin stage of cold-induced disorders, if there's a bloated abdomen and its deficiency now being created, it likes pressure, probably not the case with PID. Or we could have a mix, so palpation could be very confusing. So there's no fever typically in Taiyin stage. The body tends to feel cold. There's a bloated abdomen. There can be vomiting. There can be diarrhea, but it can be clear or a loose stool. It usually doesn't have a strong smell. It's deficiency, so probably no appetite or thirst. And the tongue can have a thin white coating. It can be tender, showing deficiency. It can be puffy. It can be pale. The pulse tends to be slow and deficient. The treatment, tonify spleen yang and warm the interior. So here we have the interior retention of cold and dampness at this stage. So we're moving from that bright fever of the Yangming stage into cold and dampness. And this is the abnormal movement of the qi up and down through the body. So we need to sometimes look at regulating the qi as well with this. So again, we have the three major classifications of acute stage PID in Chinese medicine: damp heat and toxins in the lower burner. Then the 4 levels: qi level heat, progressing to the Ying level stage. And finally, the 6 stages differentiation, where Yangming stage illness progresses to the Taiyin stage. So the indications. Well, severe or rebound pain of the lower abdominal region. Again, we can use that to differentiate PID from an acute appendicitis, and yet rebound pain can also indicate PID. So in the clinic, if we see rebound pain, we'll probably need to assume for safety purposes appendicitis and recommend hospitalization right away. However, remember that it can also indicate PID or both. So severe or rebound pain in the lower abdominal region. Red or yellow belt leukorrhea is an indication of acute stage PID. Fever, chills, diarrhea, or constipation, either way. Concentrated urine, burning sensation, yellow color. And sometimes there can be abdominal masses. They are pyogenic, they're pus producing, and sometimes they're even palpable. The treatment principle here for the acute stage PID is to clear the heat and toxins and clear the lower burner damp heat. Now let's take a look at chronic stage PID. In chronic stage PID, the wiry or slippery pulse is sometimes present. There can be a purple tongue with a white or yellow coating. And the diagnosis is qi and blood stagnation. Again, there can be lingering pathogenic factors, but the indicator of the chronic stage is the qi and blood stagnation. Indications include lower abdominal pain, yellow and white belt leukorrhea, intermittent or constant pain of the lower back, irregular menstruation, prolonged menstrual bleeding, and in some cases, palpable lower abdominal masses, and infertility. Treatment principle is to invigorate the blood and remove blood stasis and regulate the qi. And for some of you, you're probably already thinking of some of the herbs you would like to use. Diagnostic patterns, common complications. Let's take a look. Chronic PID often involves the treatment of unresolved subacute pelvic region infections due to residual damp heat in the lower burner remaining from the acute PID. The red or yellow belt leukorrhea are often indications. Both qi and blood stagnation and excess heat in the lower burner may lead to abnormal uterine bleeding, menorrhagia, that is, abnormally heavy bleeding at menstruation, menorrhagia, due to damp heat in the lower burner, occurs when heat attacks the Chang, Ren, and Dai channels, causing heat in the blood, and it causes the reckless movement of blood. So again, damp heat in the lower burner, primarily attacking the Chang and Ren, creating heat in the blood. And that causes the reckless movement of blood, and therefore the prolonged menstrual and abnormal uterine bleeding. Disorders such as chronic spotting and menorrhagia are not principally treated with stop bleeding category herbs in this differentiation pattern. The bleeding is stopped by clearing and draining damp heat and invigorating the blood. So that's almost counterintuitive. You see bleeding, you may want to quickly go for the stop bleeding herbs. Again, we'll need to look for damp heat, clear and drain it, and invigorate the blood to stop bleeding. So that's a very interesting twist when we see that what the underlying cause of the menorrhagia is. In another scenario, fallopian tube blockages may form from residual congealed pus following the acute infectious stage of PID and are indicated by lumps or pain in the fallopian tube region, general abdominal pain, irregular menstruation, pain during bowel movements, dysmenorrhea, that is painful menstruation, and the reduction of abdominal pain upon the release of blood clots during menstruation. In some cases, the original acute fallopian tube infections, the salpingitis, may be mild or unrecognized and therefore become chronic due to lack of treatment. The acute stage of PID tends to last 2 to 3 days. Later, fallopian tubes may form obstructions and adhesions from the congealing of discharge produced in the acute stage. One or both ovaries may also have adhesions to the fallopian tubes by the same process. Discharge remaining in the fallopian tubes in a fluid-like state moves downward between the uterus and the large intestine upon standing or sitting, and therefore may cause pain associated with menstruation and bowel movements. Modified Fu Ling Wan addresses this by breaking the blood stagnation and dissolving and draining dampness. So again, this is a classic formula for the treatment of PID. And we'll be looking in detail at herbal formulas, specific herbs within those formulas, and analyzing what they do, and then modified formulas and customized formulas for these treatments. Another common form of PID is dampness without heat, which is indicated by white belt leukorrhea. Dampness without heat, white belt leukorrhea. An exhaustive, long-standing chronic PID. There may be cold stagnation in the liver channel, which is indicated by lower burner pain relieved by warmth, and qi, blood, and yin deficiency. So cold stagnation in the liver channel and qi, blood, and yin deficiency for chronic PID. In many cases, chronic PID presents as a complicated mixed pattern of both cold and heat. Modified Jiao Ai Tang, and we'll take a look at that, addresses lower abdominal pain and vaginal bleeding due to cold and deficiency created by chronic illness combined with unresolved blood stasis, heat in the blood, damp heat in the lower burner, and heat and toxins. So this formula, we'll look at, it's a very specific modification. We'll go one by one on the herbs. Can take care of all of this, the blood stasis, the heat in the blood, the damp heat, and the heat and toxins. This formula is especially useful for many chronic presentations, including endometritis, which is inflammation of the uterine lining. In this presentation of PID, the endometrium, the inner mucous membrane of the uterus that sheds during menstruation, becomes infected and therefore bleeds. Untreated, infertility may result from endometritis. In some cases, PID causes constitutional depletion and has no heat signs at all. Modified Wan, and we'll take a look again at that, treats spleen qi deficiency combined with kidney yang deficiency. So now we're getting into our warming herbs. Indications include dull pain of the lower abdomen, lower back pain, white belt leukorrhea, fatigue, a feeling of cold in the body, and a cold sensation in the uterus region. Poor appetite is also present, loose stools, irregular menstruation, and menstrual pain that worsens after the flow ceases. So due to deficiency and exhaustion, the flow ceases, and now the pain is worse. The body is cold. The treatment principle is to tonify the spleen qi, tonify the kidney yang, and resolve dampness. So now we're going after spleen and kidney yang, and at the same time, while strengthening the body, we're also clearing the dampness. Let's take a moment or two to do a brief review of some of the main concepts we have covered. Review question number 1. Coldness enters what channel when there is chronic dampness due to PID? Coldness enters what channel when there is chronic dampness due to PID? The answer is the liver channel. So cold stagnation in the liver channel is caused by chronic damp stagnation in the lower burner. Indications: white belt leukorrhea, lower abdominal pain that likes pressure and warmth. Taking a look at another review question. Chronic deficiency due to PID may cause qi and yang deficiency of what channels? Chronic deficiency due to PID may cause qi and yang deficiency of what channels? The answer is spleen qi and yang deficiency. What are the indications of chronic PID? What are the main indications of chronic PID? The main indications of chronic PID are lower abdominal pain, yellow or white belt leukorrhea, constant lower back pain, irregular menstruation, and prolonged menstrual bleeding. Our next question is, what are the indications for acute PID? The main indications for acute PID are severe abdominal pain, rebound lower abdominal pain, which is also present in acute appendicitis and may indicate a hospital emergency. So if we see at McBurney's point lower abdominal pain, it is definitely time to refer out. Red or yellow belt leukorrhea, fever, chills, diarrhea, and constipation, and palpable masses. So again, acute PID is severe abdominal pain, rebound lower abdominal pain, red or yellow belt leukorrhea, fever, chills, diarrhea, and constipation, and palpable masses. Let's take a look at some of the acupuncture point selections. Common points for PID include CV4 and CV3, that is REN4 and REN3, Zhegang, GB27 and GB28, spleen 6 and spleen 10, large intestine 11 and large intestine 4, stomach 36 and stomach 40, and liver 5 and liver 3. So REN gallbladder, spleen, large intestine, stomach, and liver, and of course Zhegang. In some cases, when there's a lot of inflammation, patients may not react well to local points, and distal points are preferred. So as a clinician, you'll need to decide if there's too much local stimulation. So in this case, not always is it the case that stronger needling sensation is preferred. Discussion of the points, let's take a look at GB 27 and 28. They are the meeting points of the gallbladder, the Fuqiao Yang channel with the Dai channel. So GB 27 and 28 are the meeting points of the Shaoyang channel with the Dai channel, the belt, the girdle channel. And they regulate the Dai channel and the lower burner and treat leukorrhea. So they also treat lower abdominal pain, back pain, and irregular menstruation. So they're natural points for the treatment of PID. REN 4 and REN 3 are the meeting points of the REN channel, the conception channel, that is with the spleen, liver, and kidney channels. And they benefit both the uterus and generally the lower burner. CV3 is known for regulating the qi, and it drains damp heat. CV3 also treats leukorrhea. Again, a great point for PID. Zhegang benefits the uterus, regulates qi, stops pain, regulates menstruation, and stops uterine bleeding. So Zhegang, an extra point, is a natural for PID. Spleen 6 and spleen 10 are good choices, and they regulate menstruation, invigorate the blood, and treat leukorrhea. Alternately, spleen 8, the Shi-clef point, which regulates the uterus and harmonizes the blood, is effective in treating dysmenorrhea with excess bleeding, irregular menstruation, and abdominal pain. So, spleen 6 and spleen 10, but also the Shi-clef point, spleen 8. Large intestine 4 and 11 are commonly combined to clear heat, expel wind, and stop pain. Large intestine 11 also cools the blood, drains damp heat, regulates qi in blood, and treats high fever. Stomach 36. Stomach 36 is a command point for the treatment of abdominal disorders. It clears Yangming level heat, treats nausea, vomiting, and abdominal pain. That's interesting because a lot of people think of stomach 36 as only treating deficiency. But in reality, we can use stomach 36 for excess. There is a misnomer that it might trap the heat, but this is not the case with stomach 36. For example, it can be combined with large intestine 11, which clears the heat. Now you're supporting the body, benefiting the abdomen, and clearing heat. And stomach 36 itself can be used to reduce the Yangming level heat. So depending on if you're tonifying or sedating the point will determine the function of this point. And again, the common misconception that it can't be used in combination with external pernicious influences is not correct. It's excellent for clearing heat. Just using the sedating techniques is what's indicated for this case, particularly in febrile diseases with stomach excess heat. And stomach 40 is the low point, the connecting point of the stomach channel, and transforms phlegm dampness. So another great combination for PID. Liver 3 is the source point, the Yuan point of the liver channel. And liver 5 is another low point, the connecting point of the liver channel. So source and low, liver 3 and liver 5. Great choices. They regulate qi, they regulate the menses, and they benefit the lower burner. Liver 5 clears damp heat in the lower burner. And liver 3 treats leukorrhea and lower back pain, referring to the abdomen. Together, large intestine 4 and liver 3 are the 4 gates, and they're, of course, used to stop pain, which is always a clinical favorite. But that liver 5 clears damp heat in the lower burner, goes right to the heart of what we're looking to treat in Chinese medicine for the treatment of PID. And liver 3 treats leukorrhea and lower back pain. So great choices. CV4, CV3, Zhegang, GB27 and 28, the meeting points of the gallbladder and dye. Spleen 6 and spleen 10, alternately, of course, the She-clef point, spleen 8, large intestine 4 and 11, stomach 36 and stomach 40, and of course, liver 5 for that damp heat, and liver 3, treating the leukorrhea and low back pain. Chronic PID, we're probably going to make slightly different choices here. So those points primarily apply to acute PID and also can be applied to chronic PID. But moving over to chronic PID, stomach 36 can be maintained, but we also can use stomach 25, stomach 38, spleen 10, spleen 9, GB 26, 27, and 28, and CV6, CV4, and CV3. So adding the strong tonic properties of CV6. Stomach 36 is the command point for the treatment of abdominal disorders and treats nausea, vomiting, and abdominal pain. Stomach 36 is the lower Hussey point of the stomach and powerfully tonifies qi and blood. Stomach 25 is the alarm point of the large intestine. It regulates qi and blood and treats both dampness and damp heat. So stomach 25 is an excellent way to stimulate the abdomen to move the qi. Stomach 25 treats endometritis, irregular menses, leukorrhea, abdominal pain, and lower back pain. And stomach 25 is also effective in treating uterine masses arriving from qi and blood stasis. As an influential point of the large intestine, stomach 25 in many ways is indispensable in Chinese medicine. Stomach 38 is also effective in the treatment of abdominal pain. Spleen 10, Shui Hai, is translated as the sea of blood. Spleen 10 invigorates the blood and it cools the blood. Spleen 10 treats irregular menstruation, dysmenorrhea, abnormal uterine bleeding, and leukorrhea. Spleen 9 is the Hussey and water point of the spleen channel. So spleen 9 transforms damp stagnation and benefits the lower burner. Spleen 9 treats abdominal pain and distension, dysmenorrhea, and irregular menstruation. So both spleen 9 and spleen 10 are excellent choices. Look to spleen 10 to cool the blood and treat blood stagnation. GB 26, 27, and 28. They all treat leukorrhea and abdominal pain. So they're chosen for the relationship to the dye channel, the belt, the girdle channel. GB 26, Dai Mai, is translated as girdle vessel. And GB 26 regulates the Dai Mai, the belt channel, and alleviates damp heat. In addition to treating abdominal pain, GB 26 treats irregular menstruation, endometritis, and both red and white belt leukorrhea. So when leukorrhea is present, GB 26 is a very important point. CV6, Qi Hai, that's translated as the sea of qi. So definitely for chronic PID and not so much for acute PID. CV6 regulates qi and tonifies the qi. It tonifies the kidneys, it harmonizes the blood, it regulates the chung, that is the penetrating, and ren, the conception channels, and dispels dampness. CV6 treats abdominal pain, irregular menses, dysmenorrhea, leukorrhea, and abnormal uterine bleeding. And CV4 benefits the kidneys, regulates and tonifies qi, and is the alarm point of the small intestine. It's also the meeting point of the conception channel with the three-leg yin channels, the spleen, liver, and kidney. So CV4 is the alarm point of the small intestine and the meeting point of the conception channel with the three-leg yin channels, the spleen, liver, and kidney. Now, the Yellow Emperor's Classic of Internal Medicine notes that the Chang, the penetrating channel, the vitality channel, originates at CV4. CV4 treats abdominal pain, irregular menses, dysmenorrhea, and leukorrhea. CV3 is the intersection point of the three-leg yin channels and the front alarm point of the urination bladder. CV3 regulates the uterus, drains damp heat, regulates the menses, and assists the transforming function of qi. CV3 also treats irregular menses, dysmenorrhea, lower abdominal pain, back pain, leukorrhea, and vaginitis. So there's a wealth of points there for chronic PID, and they vary slightly from the acute. You have the stomach 36, 25, and 38, spleen 10 and 9, and GB 26, 27, 28, and CV 3, 4, and 6. No discussion of PID is complete without looking at herbal medicine. Herbal medicine is an incredibly important treatment for both acute and chronic PID, both to help with the treatment of acute PID, but also to prevent it from creating a chronic situation. So let's take a look at a few formulas. The first one we'll look at is the modified rhubarb and mutan decoction, the modified Da Huang Mu Dan Tang. We usually use this in a situation where the pulse is rapid, slippery, and wiry. The tongue is red, yellow with a greasy coating, acute PID. Damp heat in the lower burner, qi stagnation, and blood stagnation in the lower burner are all present. The indications for modified Da Huang Mu Dan Tang are lower abdominal pain that's worse upon pressure, yellow belt leukorrhea, fever, and chills. The treatment principle is to clear the heat, eliminate toxins, break blood stasis, drain the dampness, and reduce swelling. So the ingredients are Da Huang, 9 grams. Mudan Pi, 6. Dao Ren, 6. Baijiang Chao, 9. Jin Hua, 9. Lian Chao, 9. Che Xiao Yao, 6. Yi Ren, 9. Hong Tang, 9. Zhizi, 6. Yan Huso, 6. And Chuan Lianzi, 6. Dosage 1 bag per day in a 3-to-1 decoction. This formula is especially effective for acute fallopian tube infection, salpingitis. In some cases, acute salpingitis symptoms may be mild or unrecognized and therefore become chronic due to lack of treatment. In the acute stage, it tends to last 2 to 3 days and quickly progresses to the chronic stage. A key diagnostic indicator for this formula is if the patient had sexual intercourse 1 day prior to or during her menstrual cycle, followed by abdominal pain, fever, and chills 72 hours later. Another key indicator is if the same pattern occurs following the very first sexual intercourse experience. So here we have an incredible opportunity to clear the acute PID, especially if it's been completely missed in terms of a biomedical diagnosis. It's simply too mild to warrant hospitalization. The patient won't even recognize it necessarily for a doctor's visit, and it comes into our clinic. We have a chance right there to clear it and save them potentially a lifetime of difficulty. This is a modified formula. So the base formula traditionally of Da Huang Mu Dan Tang is comprised of Da Huang, Mudan Pi, Mang Xiao, Dao Ren, and Donghua Ren. So this presentation is slightly different, our modification. And notice the introduction of regulating qi herbs as well. In this presentation, we've taken out Mang Shao and we've taken out Donghua Ren. Now we've added Baizheng Chao, because Baizheng Chao clears the heat, eliminates toxins, and drains pus and abscesses. And it's an incredibly important herb for this application. Baizheng Chao also eliminates blood stasis, thereby relieving pain of the lower abdomen. Jin Yanhua and Lian Chao are added for their ability to clear heat, eliminate toxins, and work with Baizheng Chao to treat abscesses. So Jin Yanhua and Lian Chao are paired herbs to clear the heat and toxins. And then those paired herbs in turn work with Baizheng Chao, and they go after the abscesses. Ch Shao is added for its ability to clear heat, cool the blood, and relieve blood stasis and pain. Ch Shao Yao, as it's also called, treats blood stagnation in the uterus, so it's vitally important. Yi Ren is added for its ability to clear heat, drain dampness, and dispel pus. It's very gentle and mild, and is a nuance in this formula. Hung Tang clears heat, eliminates toxins, and dispels blood stasis and relieves pain to blood stasis. So Hung Tang, actually very important herb. We don't see it in many clinics all the time, but in the case of PID, we don't want to forget this herb. Hung Tang functions synergistically with Da Huang, Lian Chao, and Mudan Pi to treat abscesses, and combines with Yi Ren to dispel vaginal discharge. Zhi sedates fire, drains damp heat, cools the blood, and stops bleeding. And Zhi works well with Da Huang and Lian Chao to treat high fever with irritability or delirium. Moving into Yan Hu So and Chuan Lian Zi. Now, actually, those are, in and of themselves, paired. And they Chuan Lian Zi is also known as Jin Ling Zi. So Yan Hu So and Chuan Lian Zi actually are the formula Jin Ling Zi San, the golden bell seed powder, and they're added to treat liver qi stagnation and fire and liver channel pain. So again, another paired grouping. Lulu Tang is also added in some clinics for this formula to invigorate the blood and open fallopian tube blockages due to PID. So I want to give Lulu Tang its proper due because it's such a valuable herb in gynecological treatment. And again, it invigorates blood and opens fallopian tube blockages due to PID. There's a lot we can do with this modified Da Huang Mudan Tang formula. And for acute PID, especially the type we might see in our clinic, which is not so severe, we're going to have a great clinical experience for our patients with a Da Huang Mudan Pi, Dao Ren, Baizheng Chao, Jin Yanhua Lian Chao, Chi Shao, Yi Ren, Hung Tang, Zhi, Yan Hu So, and Chuan Lian Zi. There are many, many formulas we use for acute PID. Let's take a look at another, Huang Lian Jie Tang. Naturally, this is available in pill and powder form and one of the more popular acute stage formulas in the TCM clinic. The pulse can be rapid or full, the tongue can be red, and there can be a yellow coating. Diagnosis: damp heat in the lower burner, fire toxins in all three burners. Acute lower abdominal pain is one of the key indicators, along with red and yellow belt leukorrhea, high fever, mental restlessness, dry mouth and throat, thirst, urine, concentrated dark yellow color, and of course, burning sensation of the urine. So, classic Huang Lian Jie Tang situation. And the treatment principle for the use of Huang Lian Jie Tang is to purge the fire, release toxins, and clear damp heat. We'll also look at some modifications to using this formula. So Huang Lian, 6 grams, Huang Qin, 6 grams, Huang Bai, 6 grams, Zhi 6 grams. If there is excessive vaginal or internal bleeding due to heat in the blood, or Ying level heat, that is nutritive level heat, add modified Shi Jiao Di Huang Tang. So we're not going to use Shi Jiao. We'll use Shui Niu Jiao, the water buffalo horn shavings, which is environmentally correct and accessible. So 12 grams of Shui Niu Jiao, Shangdi 12 grams, Chishao 6 grams, and Mudanpi 6 grams. So that gets that heat in the blood, and we can combine that with Huanglian Jiedu Tang. Usually 1 bag a day, decoction of 3 to 1 to use this acute formula. Let's move over to chronic PID formulas. And the first formula we'll look at is a modified Guizhi Fu Ling Wan. So modified cinnamon twig emporia pill. The pulse can be choppy, tongue can be purple, and this is blood stasis in the lower burner, therefore the choppy pulse. Indications may include lower abdominal pain or distension, irregular menstruation, menstrual blood clots, antedated dysmenorrhea. Antedated dysmenorrhea is pain prior to menstruation, mild and persistent uterine bleeding, lower abdominal masses with pain upon palpation. So this chronic stage treatment principle would be break the blood stasis. Guizhi 6 grams, Fu Ling 9 grams, Mudanpi 6 grams, Daoren 6, Chishaoyao 6, Huang Qi, tonified qi, 15 grams. Zhao Jiao Ci, 15 grams. Shang Fu, 9 grams. San Ling, 6. Ezhu, 6. 1 bag per day. Start following the end of the menstrual cycle and use for 5 days, then discontinue until the next menstrual cycle and consume for 5 days per month. So wait to the end of the menstrual cycle, use it for 5 days, and wait and do it again. Use it 5 days per month. Very strong, breaking the blood stagnation. Ratio is same as usual, decocted 3 to 1 in water. So this formula is effective for the treatment of chronic fallopian tube infections with obstructions and adhesions. The fallopian tubes may become blocked from the congealing of discharge produced in the acute stage. The ovaries may also have adhesions to the fallopian tubes by the same process. Discharge remaining in the fallopian tube in a more fluid-like state tends to move downward between the uterus and large intestine upon standing or sitting, and this displacement of discharge creates bowel movement pressure and pain associated with menstruation. Chronic fallopian tube infection key indications include irregular menstruation, abdominal pain, and the reduction of abdominal pain upon the release of blood clots during menstruation. Chronic fallopian tube infections are distinguished from endometriosis by the character of the pain. Endometriosis-related abdominal pain worsens with each period and increases with time. Chronic fallopian tube infection pain lessens once the acute stage has ceased. Endometriosis-related pain worsens towards the end of the menstrual cycle and continues afterwards due to compounding blood stasis. Chronic fallopian tube infection pain often starts before the menstrual flow. Both conditions may lead to infertility. So that helps to distinguish endometriosis from chronic fallopian tube infections. So you're going to get the worst pain with the acute stage PID and then afterwards there'll still be pain, but not at the same level, where endometriosis can build over time and get worse and worse due to compounding blood stasis. So that's one pattern we can look for to distinguish endometriosis from PID. The base formula, Guizhi Fu Ling Wan, treats blood stasis in the womb with presentations such as uterine bleeding with clots, lower abdominal pain, dysmenorrhea, and lower abdominal masses. Here, the formula is modified to enhance its ability to treat PID and chronic salpingitis, chronic fallopian tube infections. Huang qi is added to tonify the qi. Zhao Jiao Ci eliminates toxicity, drains pus, activates blood circulation, reduces swelling, and is recognized as an important herb for the treatment of fallopian tube obstruction or adhesions related to PID. And again, this is not the formula you use when someone's pregnant, of course, and nor are the any kind of blood stagnation type of herbs, things that move the blood. So be careful with that, and particularly Zhao Jiao Ci also. Again, Zhao Jiao Ci activates blood circulation and drains the pus, and it's very important for fallopian tube obstructions. Baijiang Qiao is added for its ability to clear heat, eliminate toxins, and drain pus and abscesses. Baijiang Qiao also eliminates blood stasis, thereby relieving pain of the lower abdomen. Dao Ren activates blood circulation and removes blood stasis. And combined with Baijiang Qiao and Zhao Jiao Ci, Dao Ren treats obstructions and adhesions of the fallopian tubes related to PID. Shang Fu is added for its ability to regulate qi, treat irregular menstruation, and relieve menstrual pain. San Leng and Eizhu function to synergistically and strongly break blood stasis. So this formula, modified Guizhi Fu Ling Wan, is very important, not just for PID, characterized by classic lower abdominal pain and irregular menstruation, blood clots, but antedated dysmenorrhea, uterine bleeding, lower abdominal masses with palpation, but also specifically for fallopian tube infections. Guizhi, Fu Ling, Mudan Pi, Dao Ren, Chi Xiao Yao, Huang Qi, Zhao Jiao Ci, Shang Fu, San Leng, Eizhu. So a very interesting combination for treating both excess lingering pathogenic factors as well as regulating the qi, breaking blood stasis, and tonifying the qi. Let's take a look at another formula for the treatment of chronic PID. And this second formula is Jing Wan, hold the menses pill. This formula is available in patent medicine form, one of the more common Chinese medicine formulas, making it easily accessible. And it contains Huang Qin, Huang Bai, Chun Gen Pi, also known as E Bai Pi, Bai Xiao, Gui Ban, and Shang Fu. If you want to exchange Gui Ban, the turtle, for something more environmentally appropriate, then go ahead and choose another yin herb. The pulse indicating the use of Jing Wan would be rapid, wiry, or slippery, and the tongue will be red with a yellow coating. And the diagnosis for this type of chronic PID is damp heat and toxins in the lower burner. And specifically, we use this for menorrhagia, for abnormally heavy bleeding at menstruation or even continuous menstruation, and many types of abnormal uterine bleeding, especially from PID. Also, vaginal spotting with a bright red flow and dark purple clots. It can be red or yellow belt leukorrhea, can be accompanied with lower abdominal pain, mental restlessness, and the urine has a concentrated color, maybe a burning sensation, or even blood in the urine. So for this type of damp heat and toxins in the lower burner, we need to nourish the yin, clear damp heat and toxins in the lower burner, stop bleeding, and astringe leukorrhea. So Jing Wan is great for the treatment of menorrhagia. It stops menorrhagia because menorrhagia in this case is due to damp heat in the lower burner, but also creating a yin deficiency, and so this formula also protects the yin. The underlying yin deficiency and liver qi stagnation in this type of menorrhagia presentation causes heat, and that heat then attacks the Cheng and Ren channels. So the yin deficiency and liver qi stagnation cause heat, and that heat then attacks the penetrating and conception channels. This disturbance is heat in the blood, and heat in the blood causes reckless movement of blood, and that's where we get our abnormally prolonged menses or abnormal uterine bleeding. So again, nourish the yin, clear damp heat and toxins in the lower burner, stop bleeding, and astringe leukorrhea. Huang Qin, 12 grams. Huang Bai, 6. Chun Gen Pi, 9 grams. Bai Xiao, 12 grams. Gui Ban, 30 grams. And Shang Fu, 6 grams. So Jing Wan hold the menses pill, special for menorrhagia. Dosage is 1 bag per day, and this is decocted in 3 cups of water down to 1 in a standard boiling. Next, let's take a look at a modified version of Jiao Ai Tang. So modified Jiao Ai Tang, and this one is particularly effective for the treatment of endometritis. It is particularly effective for the treatment of inflammation of the uterine lining. Now, the original Jiao Ai Tang from the Essentials of the Golden Cabinet contains Ejiao, Aye, Shengdi, Dangui, Chuansheng, Xiaoyao, and Ganqiao. This formula has been modified somewhat, whereas the original formula is more in the treatment of deficiency and coldness in the Cheng and Ren meridians. This one is treating bleeding due also to blood stagnation, damp heat, and heat in toxins, and heat in the blood. So there are some changes in the herbs here. Let's take a look at some of the herbs in the formula, and we'll get into some details about this modified Jiao Ai Tang version and why it is so good for endometritis. It contains Shengdi, 12 grams, Chixiao, 9 grams, Dangui, 9 grams, Chuansheng, 6 grams, Aye, jarred Aye, 3, San Qi, 9 grams, Pao Jiang, 12 grams, Shang Fu, 9 grams, Yan Hu Suo, 9 grams, Pugong Ying, 30 grams, Huang Qin, 9 grams. We'll also have a modification in this formula when there is bleeding that continues. Increase San Qi to 15 grams, Pao Jiang to 12 grams, and Shengdi Huang to 18 grams. Let's take a look at modified Jiao Ai Tang. This is for prolonged menstrual flow or intermittent vaginal bleeding, leukorrhea, discomfort with bowel movement, abdominal pain, abdominal tenderness upon palpation, abdominal distension, and possibly constipation. In some cases, fever. The treatment principle with this formula is to break blood stasis and to stop bleeding. And actually, the treatment principle is break blood stasis to stop bleeding. Although we do have San Qi in here to stop bleeding, the concept is that by moving the blood, we will then stop the bleeding. The dosage is 1 bag per day, and it's decocted in 3:1 in water. So this formula is especially useful for endometritis, inflammation of the uterine lining. In this presentation of PID, the endometrium, the inner mucous membrane of the uterus that sheds during menstruation, becomes infected and therefore bleeds. Infertility may result from endometritis. Here, modified Jiao Ai Tang addresses the lower abdominal pain and vaginal bleeding due to cold and deficiency created by chronic illness, combined with the unresolved blood stasis, the unresolved heat in the blood, the unresolved damp heat in the lower burner, and heat and toxins. So this formula is incredible because we're getting cold and deficiency treated while at the same time treating the more acute stage residual toxins that have been left over. This formulation is a variation of Jiao Ai Tang and has the primary function to stop bleeding and treats injured Chung and Ren channels, as in Jiao Ai Tang. Whereas Jiao Ai Tang is more focusing on deficiency and coldness in the Chung and Ren channels, this modification invigorates blood and has heat-clearing properties. It is not recommended to add additional stop bleeding category herbs, as it is important to use the break blood stasis concept here as the primary method to stop bleeding. This presentation of Jiao Ai Tang excludes Ed Jiao to ensure that the bleeding is stopped by breaking the blood stasis. Where Ed Jiao can stop the bleeding and is a tonic, here we are more moving the blood. Note that this formula is cooked in water. The original Jiao Ai Tang was cooked in rice wine. So Chushao Yao is in this formula, and that replaces the original Bai Xiao, and that enhances the cooling and invigorating blood properties by using Chushao instead of Bai Xiao. Pao Jiang, roasted ginger, is astringent, stops bleeding, and is added to this formula to warm the channels to assist in breaking blood stasis in order to help fight the infection. So now we're engaging in warming herbs to help with the blood. San Qi is added for its special property to stop uterine bleeding without creating blood stagnation, and that's why we encourage people to consider invigorating the blood over stop bleeding herbs to stop bleeding here, that we do not want to create more blood stagnation. And San Qi is very special in its properties where it doesn't cause stagnation. The charred variety of Ai is used to enhance the stop bleeding function of the herb, and Ai also helps to warm the channels to stop gynecological related bleeding. So Ai is added to this formula. Combined with Shangfu, Chuan Sheng, and Dangui, Ai addresses deficiency and cold in the lower burner with abdominal coldness and pain and irregular menstruation with pain. So using the warming herbs to stop pain and to add the warmth to the lower burner. Shangfu and Yan Huso address blood stagnation and dysmenorrhea. And of course, Shangfu is used for its special regulating the qi properties and is very common in the GYN clinic. Huang Qin is added to clear damp heat. Pugong Ying is added because it enters the stomach and liver channels, clears and eliminates toxins, and eliminates damp heat. This formula is indispensable. We're really getting a formula that goes after both the residual, lingering pathogenic factors as well as the chronic coldness. so that we can stop the pain in the lower abdomen, while at the same time getting to the residual root source of the problem. Here, chronic antibiotic use or chronic surgical procedures, I say multiple exploratory surgical procedures, simply won't be able to warm the channels to restore health and vitality to that area. So here we have a formula that restores health and vitality to an area, while at the same time invigorating the blood, warming the channels, and also getting rid of that residual infection, that residual toxin, the residual toxins and damp heat. So an incredibly valuable formula for the treatment of PID. We started off with Huang Tang. And again, this was going back to our acute PID. And it's a very familiar formula that we had. Damp heat in the lower burner. Again, with Huang Tang, we have to be very careful to not hurt the stomach qi, because that's always a problem when going after something strong. But in these acute cases, usually we can use something like Huang Tang. In modified Da Huang Mudan Tang, we get into a little more sophisticated formula. Again, we can still treat acute PID, but now we have something that really gets into some of the heat and toxins that we're dealing with. We're regulating qi more. And this is something that's more realistic and something that might actually get missed in a Western medicine setting. So someone might come on with something that is very uncomfortable, with fever or acute symptoms, and get missed, and then it can quickly become chronic. In the chronic stage, modified Guizhi Fu Ling Wan, again, contraindicated for pregnancy, but in this case, it's a very strong formula, and you'll notice the tonified qi properties for Huang qi to keep the body strong, but also we're breaking the blood stasis, which is probably one of the key factors here in treating PID. What we're going to see in the clinic in chronic PID is people having unexplained pain in the lower abdomen and leukorrhea, which are the two main symptoms, that goes on for years and years and years. And then it can be misdiagnosed sometimes as endometriosis. There can be multiple exploratory surgical procedures. And this is one of the formulas that can get people out of that situation. Jing Wan, again, damp heat and toxins in the lower burner. And Chun Gen Pi is probably less common in the clinic, but something that we can use for menorrhagia, the abnormal uterine bleeding. So when we see that, that's our tip-off that maybe if we see a thick yellow coat on the tongue and other damp heat signs, that Jing Wan is appropriate. Modified Jiao Ai Tang. Blood stasis again. So always starting in the acute phase with damp heat and then going into blood stasis. We use this for the prolonged flow or intermittent flow, vaginal bleeding, and of course, leukorrhea. So we go into Jiao Ai Tang, very, very important formula. Notice the Shang Fu, it's slightly warming, so it does stop pain by warming, and it's offset with things like Pugong Ying, which is clearing the heat and toxins, and very cooling. This is a very balanced formula in many ways. You've got warming herbs such as Aye and Chuan Shang, balanced with things like Shang Fu, also to regulate the qi. and then cooling herbs such as Yin. So really, really a beautiful formula that can help a lot of people. Also, I want to remind everyone that you can go on to healthcmi.com anytime you want now, and you can take the quiz. You can take it as many times as you want. It'll shuffle the questions for you, and you receive a certificate of completion at www.healthcmi.com. And if we have any other questions, this is a great time to go over them now. And I hopefully you all enjoyed working on this webinar today. It's something I feel strongly about personally, that we should be good at this, because a lot of women go undiagnosed and do have repeated antibiotic use to no avail. That can run down the stomach chi. There's the multiple exploratory surgical procedures, which is not something we want for our patients, and something we can avoid by using incredible formulas like modified Jiao Ai Tang. Let's take a look at that one again. Personal favorite when there's abnormal uterine bleeding. Again, one of the concepts here is not to apply stop bleeding herbs to stop bleeding, but to look at blood stasis as one of the causes, and residual damp heat as one of the causes, causing heat in the blood. Again, I want to thank everyone. Again, a lot of the herbs you're going to see here, it enters the liver channel. Yes, regulating the liver chi and warming the lower burner can be very important in the later stages, combined with clearing heat and toxins. So there's a balanced approach of warming and circulating chi, along with clearing damp heat, and of course breaking up blood stasis. Just taking a look to see if any other questions. All right, we seem to be a little bit early today, but we do get incredible results in the clinic. It's something we should take a look at. Sometimes straight patent medicines will work in a lot of situations. A lot of times people will make a custom powder. Patients can sometimes accept that very easily. The surgical emergencies usually won't ever get to our clinics, but then we do need to pick it up after that. It's not enough just to take antibiotics and then expect that the residual damp heat will clear on its own, or there could be some exudate created by the infection that would then lead to some type of scarring or blockage in the fallopian tube. That in turn, unfortunately, causes ectopic pregnancy, and that in turn can also lead to surgery, and then that can introduce more bacterium, and then that can lead to more PID. So it's a vicious cycle we want to stop. And I want to talk a little bit about, in the last couple minutes here, liver qi stagnation. We definitely see liver qi stagnation turning into heat. And this is something that's a little different than the infectious idea. Mostly what we're talking about here are chronic infections, lingering pathogenic factors, and clearing them. However, that is the general cause of PID. There are definitely not only endogenous contributing factors here, but causative factors. So liver qi stagnation can fester and create fire enough to initiate PID as a problem. We're not going to be able to, with lab results, measure some type of bacterium or parasite or pinworm, what have you. It can be liver qi stagnation transforming into fire. So this is something to look for. It causes heat in the blood, and that leads to our bleeding, and that's, again, the same signs and symptoms, although lab results may not pick it up. And that's something that does get overlooked. I know we spent most of the time today speaking to PID in the Western medicine sense, in terms of it being something that's caused by an external pathogen. But then we have to look to the endogenous causes as well. All right. Again, we can take a couple minutes to look at that broad ligament again. The broad ligament is something that can be infected. It's not just the major areas of the uterus, the ovaries, fallopian tube. So it can be into the connective tissue itself. It's very difficult to treat. This is where a lot of the exploratory surgeries come. And we'll look a little deeper into cervicitis and cervical dysplasia in our next webinar on PID. We'll have a lot of the information we covered today in that webinar. It'll be a great review, but then we'll also take a look at those issues and get into herbal formulas for them, acupuncture points, and that treatment, and that's coming up soon. I want to thank everyone for coming today. You can see we use our Q&A pod to ask some questions and our notes to give you some feedback during the webinar so that we can get everything answered. You can also email us at info@healthcmi.com if you'd like with further questions. And again, just go on to www.healthcmi.com. It should be pretty simple and straightforward to get a certificate of completion. If you have any issues, just email us and we'll be happy to straighten that out for you. All right, I did have a review question there that came up. Yes, chronic fallopian tube obstructions. That's when we go to the modified Guizhou-Fuling one. So there you're looking at some very powerful herbs in there. Notice the high dosage of Zhao Jiao Ci. So it breaks up phlegm stagnation, but here it also breaks the stagnation. And so we're trying to free up the fallopian tube. In that case, yes, we can treat infertility by allowing the tubes to open, just as long as no one is pregnant at the time of the treatment. We wouldn't use this formula, but this is something that can be very, very handy. Again, Baizhang Chao, add it if there's more heat signs, so clear heat and toxins. And that's really one of our key herbs here. And yes, you can also add Lulu Tang, a favorite in the clinic, for opening up the blood stagnation and opening up fallopian tube obstructions. So you'll notice the Chishao also benefiting the uterus and cooling the blood. So a very, very important formula. Okay, it looks like we have everything today. And we'll sign off in just a moment. Just take the last, any other questions? Yes, we do use, I see one question coming up. We do use tonified kidney yang formulas when there is extreme yang deficiency due to chronic PID going into cold and dampness, which is usually more of a white belt leukorrhea situation, chronic low back pain, and then we'll use Jing Wan and other tonified kidney yang formulas. But usually there is some type of residual heat and toxins, and in that case you're now mixing tonified kidney yang herbs with things like Baizhang Chao, Chungenpi, Hung Tang to clear heat and toxins, clear out damp heat. And also we'll need to break the blood stasis. So those are also very good choices like that. All right, well, thank you. Also, we have our I'll take that next question in just a moment. Yes, we'll have more coming up next month. And one more question. We didn't go into full detail on chronic miscarriages, but that is something, again, that can be caused by PID, because when there's miscarriages, there can be an introduction of bacterium into the reproductive system. So especially if there's been any kind of surgery as a result, but this is a time where someone's very susceptible. So also chronic miscarriages can be a sign or symptom that there is some local inflammation, and so it can be a vicious cycle. So by clearing up the PID, there can be less chronic miscarriages. All right, if you have any other questions, email us and visit www.healthcmi.com, and you can take a look at all the courses we have there. We have many courses on a variety of topics that you can take anytime, not just at a specific time and date. So you can go on and take those, take a quiz, and get a certificate of completion. And yes, that's good for NCCOM credit, California, Florida. We have courses in Illinois, Texas, and all the rest of the states. Most of them are covered by the NCCAOM, and that includes the CTCMA and CAAA in Canada.